Hello everybody, this is Dr.Goparaju. So in this specific video, I am going to explain you about the research, what is that I have carried out. Right, see basically the research is about what are the top two macroeconomic factors contributed to the pandemic in India. This is not only India specific data, I have considered world specific data as well. I will tell you first I will tell you what is this research about, and then I will show you the conceptual model I have designed. I will tell you what are the data sources, hypothesis definition, and what are the statistical techniques I have used, and some of the graphs I will share you, and finally I will share you the research findings as well. Research findings as well. Right, see basically during 2020 second quarter, by May 2020 and June 2020, in the first wave of COVID, the lot of data keep coming in the newspapers and websites, different websites and public media, right? So that attracted me, can we do anything with this specific data, right? So then I started gathering data from different websites and thought of finding out what could be the, this is basically for the academic purposes. Okay, kindly focus, this is only for the academic purposes, right? So what could be the factors, major economic factors, or what could be the major factors affected the COVID deaths in the country or in the world, across the world? I thought of finding out because a lot of data coming from Brazil, US, India, other countries as well, and European countries, right? So then what I have done is I have gathered data from mygov.in, and then Niti Aayog data, similarly Weather India data, Worldometer data, and World Health Organization, World Bank, these kind of organizations data pulled in, gathered the data, and basically what is the main objective of this research is to find out what are the macroeconomic factors contributed to the COVID deaths. So second one is what are the macro health factors contributed to the COVID deaths, and third one is what are the macro weather factors contributed to the COVID deaths. Right. So among these, which is the top factors? Which are the top two factors? That is the main objective. So this is basically the presentation is about the contents of the presentation. Right. So these are the research questions. What could be the macroeconomic factors? What could be macro health factors? And what could be the macro weather factors? So among economic factors, I have this is the conceptual model I have designed. Among the economic factors, I have considered, first population, GDP, literacy rate, and then poverty rate. Is there any effect of poverty rate over the COVID deaths? That also I wanted to study. Similarly, GDP, population, these are the factors I have considered among economic factors. And among health factors, I considered composite health index of the, this is basically a data collected from 28 states and 8 union territories of India first. First, I collected data of 28 states and 8 union territories of, because this is coming in public media, right? A lot of data. Right. So among health factors, what I considered is composite health index, immunization percentage, TB reported cases per 1 lakh population. Next, health scheme coverage or insurance coverage in the state. How much percentage of people are covered with respect to insurance in the state? Life expectancy rate in the state. So these are the macro health factors I considered. So next one is the macro weather factors. What is that I considered? Average high temperature, average low temperature. So this is over a period of 60 years. What is the average high temperature, and what is the over low temperature in this specific state? Right, over 60 years of data. Based on that, I pulled in some of the consolidated data is available over the net. So I pulled in that data as well. Right. So what are the dependent variables? Dependent variables are confirmed cases, active cases, recovered cases, and number of deaths. So this is basically these are the dependent variable, and independent variables are the left side ones. Left side ones indicate all these are the independent variables. Right. So let's move on. this is simple hypothesis, assumed null hypothesis. There is no relationship between population and COVID-19 days. There is no relationship between state literacy rate and COVID-19 days. Like, similarly, there is no relationship between state GDP and COVID-19 days. Like this, I have defined the null hypothesis. So later on, based on the correlation and regression values, I have either accepted the null hypothesis or rejected the null hypothesis. Let's move on and see. So these are the data sources. From India specific data I have taken from mygov.in, Niti Aayog, Weather India, World Weather Online, these kind of websites. And then world specific data collected from the World Bank, World Health Organization, WHO, and then the Worldometer dot info, right? So let's move on. So what are the research I have done with the India specific data? This is basically in this kind of research, literature review plays very minimal role, because this is basically a data oriented research, so data intensive research basically. So I will show you the data table also. I have whatever I have consolidated, right? So India specific, this is the India specific data table. So these COVID related statistics are of July 16th, 2020, first quarter of, after first quarter completion, or second quarter completion of 2020, right? So this is the data, right? You can see different 28 states and 8 union territories data, different almost independent variables and dependent variables data is this, right? So now I found out, this is the correlation and regression techniques I used. Some graphs I have drawn, and also I used the Excel for simple, right? Using correlation regression in Excel is easy, right? So I used Microsoft Excel, let's move. This is basically, this is important. This is what is the GDP. So this graph gives that top 5 economies in the country are Maharashtra, Tamil Nadu, Gujarat, Karnataka, and Uttar Pradesh. These are the top 5 economies in the country. Maharashtra, there is a huge gap between Maharashtra and Tamil Nadu as well. Maharashtra, $450 billion is the economy size, and Tamil Nadu $290 billion. Put together it is coming to $3 trillion of economy, Indian economy 2019. I have gathered. See approximately the values. Take the approximate. Just see the methodology. Okay, don't look at the exact figures. Okay, let's move on. Look at the methodology. What we did. Right, let's move on. So this is about the Indian states and their GDP share. This is based on the values. A pie graph has been drawn. So indicating that Maharashtra, could get the maximum pie. That is 13.81% of GDP is contributed by Maharashtra. Next comes Tamil Nadu, 8.9% of GDP. So because this graph, it correlates with the COVID deaths. Just next graph. See the next graph. See this, it is very evident from these similar graphs. COVID, GDP, GDP share, and then COVID share, COVID death share in Maharashtra. Similarly Tamil Nadu. See these graphs itself are correlating, right? So similarly, that means we can assume here in this stage itself there is a relationship between GDP and the COVID deaths. So let's move next one. See the population. This is population share of different states in India, right? Similarly, West Bengal, 9.36% population. So like this. So this next, what is the population share, and then COVID confirmed cases share, right? So this is a graph. Let's move on, and this is the correlation matrix, right? So basically correlation matrix here, it indicates that 0.74 correlation coefficient value, that is state GDP is strongly correlated, very strongly correlated with the number of COVID deaths, state GDP. Next highest is the 0.43 correlation coefficient value, that is the population. That means population is closely average to strongly correlated to the COVID-19 deaths. That means these are the two factors. And just see another one, that is average low temperature, average poverty rate, that is poverty rate has got a negative correlation with the COVID deaths. That means it is got nothing to do with COVID deaths. Poverty has got nothing to do with COVID deaths. Similarly, there is a negative correlation between low temperatures and life expectancy. That means, there is no relationship between average low temperature in the country and the life expectancy. That means in colder countries also people live longer life, and also in warm countries also people live longer life. There is no relationship between lower temperature and the life expectancy, right? So let's move on. See the this is the regression. So basically this regression, it indicates that there is a significant instance less than 0.05 actually we were I was expecting. So this average low temperature, 0.06 has come. That means it is a little bit impact over the COVID-19 days average low temperature, right? But whereas with respect to GDP and population, there is no effect of them on the COVID-19 days with respect to regression. With respect to regression. So let's move on, and these are the findings. Right, that means there is a strong relationship between that means correlation point 74 strong relationship between Indian states GDP and the COVID-19 days. So second strong correlation is the population and the COVID-19 days, right? And average low temperature has effect over the COVID-19 days, it is closer to 0.05 p value, right? Similarly, there is it has health insurance having as the health insurance scheme, hmm, has got no relationship with COVID-19 days, right? Similarly, life expectancy rate has got nothing to do with temperature of the country, right? These are the findings with respect to India specific data. So now let's move on and see what is that I have done with the world data. See, basically, with India specific data, I could find that GDP and population are the two factors contributing to the COVID-19 deaths, right? So then what I have done, is it correct with the world data also? World data also, right? So for that purpose I have gathered around 196 countries, 196 countries data, and then applied the correlation regression techniques, right? The conceptual model is this. Here I considered only two independent variables, that is COVID-19, this is two independent variables are country GDP and country population, and dependent variables are COVID confirmed cases and number of deaths. So similarly, this also, around 196 countries data I have pulled in. And this is next day data, that is July 17th data of 2020, right? See the, here itself the relationships are indicated, right? How GDP is moving, and COVID cases, confirmed cases and deaths are moving, right? Three different line graphs, relative positioning, right? World countries and COVID status, GDP and COVID status. Similarly, population and COVID status. As population is moving, these cases were also moving, right? Let us see statistically what that we could get. So these are the findings. This is the output of a correlation matrix with respect to world data, right? So there is a strong, very strong correlation between GDP and the COVID-19 days. That means, 0.73 the correlation coefficient value. Next, average correlation is there between population and COVID days. That is with respect to world data, right? And also regression also I have found out. So regression also, in the in world data case, both GDP and population have given p-value less than 0.05, indicating that both GDP and p-value have significant, both GDP and population have significant effect over the COVID-19 days, right? So, so let us summarize the findings. So this is the, with respect to world data, what we could get is, these are the relationships. Strong, very strong relationship between GDP and COVID-19 days. Similarly, population and COVID-19 days, strong correlation. Hmm? Obviously GDP and population, these are also strongly correlated, right? So these are the findings, and regression also proved this concept. Both the correlation and regression with respect to world data, we could get that GDP and population are both related, and also they have effect over the COVID-19 days, right? This is the hypothesis, whether accept or reject based on the correlation coefficient values and regression coefficient values, right? So So overall, we can based on this research, we can say that top two macroeconomic factors contributed to the COVID-19 deaths across the world are, one is the GDP and the another one is population. This is because, we cannot stop the economic cycle. We cannot stop the economic cycle. People are mobile, right? So that is the reason, it could spread probably. Right. So these are the top two factors contributed to the COVID-19 deaths. Right. So further research, can be done based on considering the biotechnology aspects or the individual attitude, behavior, and the individual mobility, personal hygiene and self-discipline. These kind of factors also can be considered further as a, further scope for research to find out what could be the reasons for COVID loss. Right. So basically this is only my contribution towards, I thought, is there anything I can do with COVID data? So a lot of data was pumped, this is last year I have done this data 2020, this research, right? So hope this will be useful. This is only for academic purposes, and also, it is only for academic. Poverty has got nothing to do with COVID. It is only the economic, GDP. The more the GDP you are having, that is the reason, right? So economy was continuing and people were, mobile. So that could be the reason to spread of the pandemic, right? Thank you, everybody. Thank you.